Hey you guys, welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before starting on any of our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner and I am the founder and CEO of the Nursing Studio. I provide resources, tools, courses, review books, as well as videos to assist nurses and nurse practitioners with success on boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. And let me tell you something, I am so hyped from all of the messages. I don't know what it is this week. I don't know if this is our golden week. This is our Hall of Fame week, whatever you want to call it, but y'all have been on it. I appreciate y'all reaching out to me because y'all have no idea how I genuinely am so happy for you guys. I've been really, I've been doing this for so long, but doing more YouTube videos. So the feedback really helps me as well because I don't know if y'all are finding it beneficial unless y'all tell me, you know what I mean? And so to hear y'all, the phone calls and saying, oh my God, this helped me so much. I can hear you on my test. I passed boards, or we've been working in our one-on-one sessions and getting that call after your exam. Listen, y'all have been on it this week. You did the work. Congratulations, you guys. I wish you nothing but success. And y'all go shine y'all light on this next level of your nurse practitioner journey. I'm just so excited for y'all. But anyway, I went off on my rant, but let me hit my disclaimer. Y'all know there's no absolute medicines. We treat on a patient by patient basis. And any of the questions that I provide, I have designed based on what guidelines they are currently tested on the ANCC as well as AAMP. Y'all know I get into all of this information so that I can make sure that I'm providing you with the things that you need so that you can be successful. So I design it so that you can gear your mind to what to expect, okay? All right, so question number one for today states a patient presents to the office today for follow up. The patient denies any complaints at this time. Upon examination, the nurse practitioner is reviewing recent lab work. Fasting glucose is 99, total cholesterol is 200, LDL is 98, and triglycerides are 522, and the HDL is 50. What diagnosis should the nurse practitioner consider? Is it A, type 2 diabetes, B, hyperlipidemia, C, pancreatitis, or D, prediabetes? Take a moment and tell me what you got in the comments. All right, you guys, I always recommend reading the stem of the question first. I always say this so that it allows you to slow down to ensure you are answering what the question is even asking you, right? So the stem of the question states, what diagnosis should the nurse practitioner consider? All right, so if we're talking diagnosis, let's run it back. Let's see what the assessment is. What do we have here? So the patient has come into the office today for follow-up. They deny any complaints at this time, and the nurse practitioner is reviewing the lab work. The glucose is 99. It's a fasting glucose. It's a high normal, but it's still, fine. Total cholesterol is 200. Again, high normal is still okay. LDL 98 is high normal. But again, with these high normals, we're watching these, right? We're doing these lifestyle modifications and watching these, but we're trying to figure out a diagnosis right now. Triglycerides 522 and HDL 550. HDL is fine as well, right? But those triglycerides are through the roof. Number one, we know we don't want the triglycerides to exceed 150, but we're talking over 500. Whenever you see triglycerides greater than 500, in your mind, you need to think, let's consider pancreatitis, okay? So here, the best answer is C, pancreatitis. All right, question number two. A patient presents to the office today with complaints of sudden pain to his great toe. The patient states that the pain is excruciating and he is inquiring if the pain may be gout. What lab should the nurse practitioner obtain to aid in diagnosing? Is it A, a lipid panel, B, a uric acid level, C, hemoglobin and hematocrit, or D, a ferritin level? Take a moment and tell me what you got in the comments. All right, so the stem of the question states, what lab should the nurse practitioner obtain to aid in diagnosing, right? All right, so this patient came in complaining of sudden pain to the great toe. He's wondering if it's gout. Presentation sounds like gout. So the nurse practitioner is doing her processes to see and confirm that diagnosis, right? So, what is a lab that we can utilize to aid in that diagnosis of gout? And we should know instantly when I'm saying this or lab work and gout, you should instantly think uric acid levels, right? Because if that uric acid level is elevated, that's a key indicator of gout potentially, right? So your best answer choice is B here. All right, and question number 3 for today. The nurse practitioner and NP student are discussing adding a long acting beta agonist to the COPD regimen. Which medication would be appropriate? Is it A, albuterol, B, levoalbuterol, C, salmeterol, or D, Spiriva? Take a moment and tell me what you got. All right, so the stem of the question here states which medication would be appropriate. So here, the nurse practitioner and NP student are discussing adding a long acting beta agonist, right, to the COPD regimen. So you need to know what is a long acting beta agonist, right? So it's asking which medication is appropriate. Is it A, albuterol? No. We know albuterol is a short acting beta agonist, right? We know we use albuterol as our rescue inhaler, right? So we know that's not long acting, it's short acting. Okay. So that's a SABA. When I say long acting beta agonist, those are your LABAs we're talking about, right? Is it B, levoalbuterol? No, because also levoalbuterol is a short acting beta agonist. I always say, listen, those albuterols are short acting beta agonists. That is like your also, I always say no generic and brand name. This is also like your Zopanex, your Ventolin, things of that nature, okay? But albuterol, levoalbuterol, short acting beta agonist, okay? What about C, salmeterol? Yes, you should go with C, salmeterol. Salmeterol is a LABA. It is a long-acting beta agonist, okay? And D, Spiriva is not. Although it's long-acting, it's a long-acting muscarinic agent, okay? So make sure you know your medicines, okay? The generic and brand name. So if they're asking you treatments and things of that nature, you're not missing things that you know just because you don't know the drug class or you don't know generic versus brand. And again, sometimes they will give you one or the other at least one time, especially AAMP, they'll tell you like both, like metformin and glucophage. They may say it one time, but when that diabetic question rolls back around, they typically won't show the two anymore, okay? But anyways, that's it for today, you guys. I hope you found this helpful. As always, be sure to like, comment, and subscribe and share with whomever you may think may find this beneficial as well. But make sure you meet me back here. Um, if you need any assistance, any further assistance with any of our reviews to help you on exams in schools, for boards, practice, let us know. Again, you can give us a call, 803-400-6864, or shoot us a text to that number, or shoot us an email at thenursingstudio, the number one, at gmail.com. We offer a review book that you can take the ebook option or the paperback option to get shipped to you. If you go the ebook route, you have instant access once purchased. Both of those links are in the bio of the YouTube channel. The website link is also there. We have a self-paced review course that you can utilize at any time. And then we have 5-week courses that roll around. Our next one is about to roll around. You will see that. You guys have reached out to me about that. Some of you have already started signing up. I'm excited that y'all are excited to do all of the things to prepare. But yes, that is up and another one's up and coming. And then lastly is our one-on-one sessions that you can choose to focus on a weakness, or you can do the custom plan where it is based on what you're trying to prepare for, how long you want to prepare. Most commonly utilized by reviewers who have previously been unsuccessful and are looking for something to help structure and get them back on for a successful attempt. And we have a 100% pass rate on our one-on-one sessions. But anyways, you guys, as always, make sure you meet me back here. Happy studying. Bye, y'all.